Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Of course. Good afternoon.
So everybody, my name is Dilshad Burman. I am a writer and reporter for CityNews and 680 News, and I will be moderating this chat today. How it works is we have been collecting your questions over the past week, and the doctor doesn't know what we're going to ask her, but we're going to present them to her, and she's going to try her best to answer them. And we're going to try and get in as many questions as possible. If you haven't had a chance to submit your question, you can still do so under this live broadcast. And like I said, we'll try and get to them as many as we can in this short 30-minute period that we have. So, Doctor, let's get started. We have lots of questions to get through today.
Okay.
All righty. So let's start with, again, vaccine questions, because those are top of mind for people this week as well. Let's start with Jennifer. Jennifer asks, why has the AstraZeneca vaccine been approved in other countries but not in Canada? Any idea, any timelines as to when it's going to be approved? And will that approval then quicken the time frame of when it is released to the general public?
Okay, so I want you to know the reason why AstraZeneca has not been approved is because it's going through the Health Canada approval process. And I know that some people have concerns that maybe the approval process has been sped up or that they've missed steps. And so that was not the case with Pfizer. It was not the case with Moderna, and it's certainly not the case with AstraZeneca. And so part of why it hasn't been approved is because the approval process is ongoing, and Health Canada is maybe asking them for more data, maybe asking for some more information before they can feel confident enough to approve it. Once it is approved, then that will be another source for vaccine supply. That's why it will be important, because then we can have more doses. It will also be important to see who the vaccine will be licensed for, and that will also help to be able to get more people immunized as well.
Right. Doctor, when it comes to these three vaccines that we're talking about right now that are coming to market, is there a difference in their efficacy? Is one better than the other? Like, if I have a choice to take one over the other, should I choose Pfizer, should I choose Moderna, or should I choose AstraZeneca?
Well, I can only comment on the two that have been approved and licensed. Moderna and Moderna and Pfizer, 94%, 95%. So they're practically the same. It's about 95% efficacy. Both of them are very good. So we'll have to wait to see with AstraZeneca what their efficacy is as well.
Okay. Okay. And then I guess Tanya had the same question about the Oxford vaccine, which is the AstraZeneca vaccine. So let's move on to, this is a question from Twitter. So the handle is @42thetruth. Again, asks when AstraZeneca will be approved in Canada, but what other vaccines are also nearing completion?
I'm only aware that AstraZeneca is kind of around the corner in terms of approval. And so the other vaccines, I mean, there are a dozen or so, maybe even more vaccines that are in the pipeline undergoing studies. And it will be up to those vaccine manufacturers to submit their plans, their application for approval. That is what they have to do. It's not that we reach out to them. Yeah.
Right, right. Okay, more vaccine questions. Mags asks, will in-school teachers be considered as essential workers and receive the vaccine soon or sooner than others?
Yeah, so I've had this question asked, and I think what I want to say is it's the provincial government, the vaccine task force that is coming up with that prioritization. We know who's in the first priority group. It's that second priority group where essential workers are included, who will be included in that. And that has not come out yet. And so we can expect to wait to hear on that.
Okay. And then we have a question coming in live, actually from one of our team members. Diana asks, once a person gets their second dose of the vaccine, are they safe from severe symptoms immediately? Or if not, how long does one have to wait until that second dose kicks in?
We say 7 to 14 days. Usually for vaccines, we say 14 days. So that is the more conservative estimate, but somewhere between 7 to 14 days, you'll get the best effect of that second dose.
Okay. And then Jennifer has more of a timeline question. She says that she's been discussing with her coworkers, and one of the things that was said is that once we get the vaccines into Canada in the timeline that Prime Minister Trudeau has mentioned, everyone in Ontario that wants a vaccine should be able to get vaccinated by the end of May. Is that a correct timeline in your estimation?
It all depends on vaccine supply. And I think once we have vaccines, I think you can see that we can mobilize a lot of our healthcare workers to be able to vaccinate. I can tell you yesterday, I was in a long-term care home vaccinating residents and staff there. And that's not something that I do on a daily basis, but certainly signed up for it to get those people vaccinated quickly. And so once we have vaccine, right now, that is our rate limiting step, is the amount of doses that we have. The people who will be there to be able to vaccinate will be ready. We have a clinic actually that we're planning for Monday in the city, and that's our kind of first proof of concept clinic for a mass vaccination clinic, where we can then have hundreds of people come through the Metro Toronto Convention Centre or other locations to be able to vaccinate them. And we're hiring more nurses and staff to be able to facilitate that. So right now, it's about getting doses. And then if we have them, I'm sure we can vaccinate hundreds of thousands of people without problem.
Right. And actually, just on that note, I'll just plug really quickly. On our website, we have a vaccine timeline calculator. It was created by a University of Guelph student and a physicist in the UK. And just based on the current data from the federal government, provincial governments, and just based on the priority groupings, they have a rough estimate of when you might be able to get the vaccine. So you can check that out on citynews.ca right now. And it might not be very accurate, but it might give you some sort of idea of where you'll be in the line based on your age, your occupation, what you do for a living, all of that kind of stuff. So just wanted to plug that in there, citynews.ca for that. And we'll move on to our next question now. Fred asks, how long will the COVID-19 vaccine last? So I'm assuming, how long does it stay effective?
We only have data up to, a few months so far. That's all we have, because that's when the trials were done, and we can follow those people. We will certainly be following those people for a few years to make sure that they continue to be protected. I think what we can say is, if we find that the immunity is waning, meaning that it's not staying as strong, often with vaccines, you can give a booster dose, and that can help to prevent waning immunity and to keep protection lasting longer.
So on a related note, then we have a live question coming in from Mazid. They ask, will we need to take the vaccine every year like other flu vaccines?
Yeah, so we're not sure on that. Now, I think what's important to note is this vaccine is against the spike protein on the virus. And as long as that spike protein doesn't change, the vaccine itself should be able to continue to offer protection. And if it's a booster dose, it's a booster dose. Whereas for influenza, it's different. The way the influenza vaccine is made, the vaccine itself sometimes, as the virus changes, doesn't offer that same protection. And so we'll have to wait and see.
There's a lot of wait and see for sure, because again, it's a brand new vaccine, brand new virus, lots of things to consider before those questions can be answered. Let's move on to another one. You just mentioned actually the kind of vaccine that this is, that it targets the spike protein. So Marco asks, I heard that the shot, the COVID-19 shot, is an mRNA therapeutic designed to change how your body produces protein in a specific set of circumstances. How is that different? How is that different than a vaccine?
Okay, so this is not a therapeutic, this is a vaccine. So the vaccine, a messenger RNA that you have is like an instruction manual. And so you get injected that instruction manual. It gives your body the instructions to say, produce this one protein. So it makes the spike protein, actually, your body actually produces it. And then by making the spike protein,
sorry, doctor, we lost your audio for a second. Sorry, doctor, we've lost your audio. There we go. So going back to the instruction manuals, yeah. We're still not hearing you.
Okay, sorry. Yeah, we're good. Okay, yeah. Sorry. Okay, so the instruction manual, your body produces the spike protein, and then your body makes antibodies against that spike protein.
Right.
And so within a matter of days, weeks, the messenger RNA is gone from your body, and the spike protein is actually also gone, because by producing those antibodies, that protein that's made is actually also gone from your body. And so there's nothing left. It doesn't interfere with your normal proteins in your body, your normal DNA in your body. What it does is give instructions that ultimately lead to producing antibodies.
Right. Got it. And then more practical question here. Ellen asks, do people still need to wear face masks after receiving the first dose of the COVID-19 vaccine? She thinks that this is very important to prevent further viral spread.
You need to wear face masks even after the second dose of the vaccine, actually. So face masks, physical distancing, washing hands, staying home if you're sick, all of that, none of that is going to change in the short term. And the reason for that is, first of all, we have to make sure that we have enough people vaccinated so we can have that herd immunity. And we also don't know right now the answer to, could you still get an asymptomatic infection, an infection that doesn't make you sick, but where you could still spread it. And so you want to be able to prevent that until we can answer that question as well. We know the vaccine will do good to prevent a severe infection, a symptomatic infection in people who get the vaccine.
Okay. So doctor, when you say, after taking the vaccine, we still have to continue with all of our measures, we've been seeing a lot of comments online saying that, well, if nothing's going to change, I'm not going to take the vaccine. What would you say to people that feel that way to encourage them to take the vaccine?
It's not that nothing's going to change. It's just that immediately we still have to continue with it. And, take the example of polio. The vaccine came along, the rates were very high, and the rates came down, but it still is going to take months for enough people to get vaccinated to create that herd immunity. And so until we're confident that our rates are low, that the vaccine is going to protect more people, we need to maintain those measures. But again, the long-term outlook is that hopefully one day we will have a very good handle on this virus and can ease up on those. It's just the time for that is not yet.
Right. It's not, I think everybody's used to instant gratification, and it's not that right now. It has to be, enough people have to get vaccinated, first of all, in order to even ease up on anything, right?
Yeah.
Right, okay. And then let's see. Frankie says, my sister got COVID in April of last year. It was very bad. She was in Sunnybrook on a respirator for 1.5 months. It took 3 tries for her to get off the respirator, and now she is a long hauler. Somebody who has symptoms, not symptoms, but fatigue and things like that they've been experiencing as a result of COVID. So Frankie asks, can a person who had it that bad get COVID again, and should they be vaccinated? Because if they've had it that bad, the antibodies and the immunity should be quite high. So should they still take the vaccine? Can they still get COVID again?
Yeah, well, Frankie, I'm really happy to hear that your sister has improved. We still recommend that those who had COVID, whether it was a mild illness or severe illness, get vaccinated. We know that there are cases of people who have had reinfection, and we don't know how long that immunity lasts if you've had an infection, whether it's a mild or a severe infection. And the vaccine is considered safe in people who previously had COVID. And so that's why we would still say to get vaccinated.
Okay. And then Jim asks, when one gets vaccinated and the person doesn't experience any side effects, is it possible that that individual had already been infected by COVID-19?
No, that those two things are very different. So the vaccine and your response to the vaccine is an immune response, and it's totally independent of whether you previously had COVID, are incubating COVID, or have nothing to do with COVID. Those are very, very different situations. We actually are finding that people who are vaccinated are having very mild symptoms or no symptoms at all. I've told you I had a very sore arm for a day and a half, and that was the only symptom I had. Some people are getting that headache or flu-like symptoms, but it's actually small, maybe 4% or so. And so some people will actually have no symptoms, and that is great for them, but doesn't mean the vaccine's not working. It doesn't mean that they previously had or didn't have COVID.
Okay, those two things are not related, basically. Okay, let's go on to the next question. These are, we're done with vaccine questions for now. Let's go on to some, a mixed bag of questions here. Anonymous asks, is there an extra danger to the UK or South African variant of COVID-19? Do they spread quicker? Do they cause more deaths?
So what we're not quite sure, but what it seems is that the UK variant may be more transmissible. That means that it may spread more easily. Maybe it spreads more easily in younger children. And so that's one thing that we have to keep track on. Do our public health measures work as well in a virus that is more easily spread? That's one question. What it doesn't seem, though, that it's more severe, that more people are more likely to get sick. But the more people that get infected, we know that a proportion of them will get serious illness. And so that's the risk there.
Right. Okay, so it's not necessarily stronger, but it's definitely more spreadable, so to speak.
Exactly. And so if more people are getting it, a small proportion of those will get seriously ill.
Right, absolutely. Okay, this is about PCR testing. We get a lot of these questions. So Corey on Twitter asks, the World Health Organization recently admitted to false positives in PCR testing with high CT. I'm not familiar with the term, but with high CT. Everything I have read says 25 CT is okay, but in Ontario, we are using 40 CT, which can provide false positives. How much can we rely on COVID numbers when we're using this testing method?
Okay, so CT is a cycle threshold. It's very specific to the PCR test. And each lab can have their own cutoff. So it's not that, I haven't actually heard of a 40 cutoff in Ontario. Usually it's around the 30s that we're using, but each lab has their own threshold that you need to check to see. What it shows is that if you have based on the CT results, you can have a sense of whether this infection might be related to a previous infection, might be related to a false positive. Repeating the test might be necessary in some of those circumstances.
Okay. And so just for everybody's sake, then we talk about PCR testing a lot, and the fact that there can be false positives. When it comes to false positives, do you know maybe how often that happens? How reliable are these tests in that sense?
So again, this goes back to our discussion on pre-test probability. So if you're doing testing in people who have symptoms, who have been a contact of someone who actually you think, oh my goodness, they could have COVID, and you test them, the false positive rate in that situation is lower. But if you are just randomly testing thousands of people who have no symptoms, that's the situation where you can get more false positives.
Right, and currently we're not doing that in Ontario. We're testing people with symptoms and with probably high pre-test probabilities, right?
Yeah, except there are certain professions like staff who work in nursing homes who are getting tested on a weekly basis. Yes. It would be in that type of situation that we're more likely to get a false positive result, need some more investigation.
Okay. And then this is a good question. Sonia asks, can testing be mandatory in a workplace if no one has symptoms, just related to what you said right now?
So each workplace has to come up with their own policies. Whether they mandate a test or not would be up to the workplace to determine that. And so I can't comment on every single workplace. What I would say, though, is screening is something that's required. That is something that is required before everyone goes to work. But testing from a public health perspective is not mandated in most workplaces. But again, like in a long-term care home, testing is required there for workers.
Right, exactly. Depending on the setting. And like you said, essential workers are getting tested every week. So that it can happen.
Yeah.
Right. So,
but not all essential workers. I just want to say it's very specific settings.
Yes, absolutely. Because even we have our grocery store workers and stuff who are also essential workers, and I don't think they get tested every week. So yeah, okay. So let's move on. We've got a lot of household questions, like people living in certain circumstances. So Jenny asks, I live in a blended household. 3 different families of children overlap. How are we as parents and step-parents supposed to manage combined households? It's not just 2, it's 3 different households. What are the extra precautions that we could be taking?
Yeah, so I mean, life is complicated, isn't it? So I think what I would say is, first off, if someone has symptoms, they test positive, or they're a close contact of someone, if you cannot isolate that person safely in the home, consider the voluntary isolation center, because I think that that's something helpful. And I think as much as possible, recognizing your household, you want to avoid any other contact with anyone else. And so while your household may be complicated the way you define it, it is the people that you live with. And recognizing that there are situations where a child may have two households, two roofs that they live under, for example, that's fine, that's their household, but to limit their contact that way. And so I think anyone who lives in these blended families or blended households, they themselves need to make sure that they have very little contact with anyone else outside the household to minimize the risk to everyone.
Okay. And then Shailendra is one of our regular viewers. He asks, if all members of the household are positive, do we still need to isolate?
So that happens sometimes in some households where one gets it, then another gets it, then another gets it. Eventually, everyone in the household gets COVID. And certainly by the time you've gotten COVID, you don't need to isolate while others are still isolating. But I think the point is that the isolation is actually really important in the beginning. When you have the first person who's positive, isolate the others so that you can prevent them from getting it.
Right. And of course, they have to isolate from everybody else. They might be able to isolate within their own household with everybody positive, but stay away from everybody else.
That's right. Until you're cleared, you still cannot leave the house. That's right.
Right. And then he has a follow-up question. Let's say an individual who already completed their isolation period develops fever-like symptoms, or thinks he might have been exposed after 2 weeks. Can that individual go for retesting again? Because they already tested positive, they finished their isolation, they feel like they're getting symptoms all over again.
Okay, so if they're a contact of someone 2 weeks later, I mean, we wouldn't recommend that they get tested if they don't have symptoms. Now, if, however, they have now full-blown symptoms, a fever, cough, a feeling unwell, and it could be another COVID infection, there may be recommendations that they get tested because, again, you can get reinfected with this virus.
Yes. Okay. And then let's do some business-related questions. Lots of people have questions because the recent the measures that we heard yesterday. So Percy asks, I have a food delivery and catering service where I offer pickup from 4 different locations across the GTA. So that's downtown Toronto, Etobicoke, Scarborough, and Mississauga. He says he's not a restaurant. He drives to a designated location like a parking lot and people pick up food from him. So under the new measures introduced yesterday, can he still move around like this? And will there be fines for moving between different zones?
So we're waiting for, I haven't seen yet the regulations for, what's written in terms of what is required and what's not required. I think, there is curbside pickup that is still allowed. What the parameters of that will be, we're still waiting for the regulations to be able to kind of help you get some clarity on what would and would not be allowed.
Right. But in general, moving between zones, that's not going to be something that's recommended.
If you're moving for essential work reasons, then you can still continue to do your work, right? But in general, beyond going out for those essential reasons, for healthcare, for groceries, for exercise, or to work, you really should be staying at home for all other reasons.
Okay, got you. Okay. So Jessica asked then, in terms of essential businesses, how do you classify essential businesses? Because you can see more COVID in workplaces right now. And the list of non-essential businesses that was released in March was so general that almost every business looked like it was an essential business. So what is classified as an essential business?
Yeah, again, so we're waiting to see what is classified. Like, this will actually be written into the regulation. And this was there, like in the gray lockdown zone, it was clear what was considered essential and could open and what could not open, what could open just for curbside pickup or delivery, for example. So some of this should come in the regulations that will be posted.
Okay. Okay. And then let's go back to the household questions here. Mufasa asks, if a man who lives in the same city as his mother and says he tested negative a few days before and has not seen his mother in 6 months, can he visit his mother?
Right now, you should stay home, Mufasa, and visit your mom virtually. Now is not the time to be visiting your mom. It's really stay-at-home orders, and that's really what is the recommendation right now.
Right. Barb in Mississauga asks, I am a senior with health issues who lives alone. Under Ontario's new stay-at-home order, will I still be allowed to be considered part of my son's household who lives nearby? Are we allowed to remain in our respective homes and be in periodic contact as needed without the added risk of me moving into his house and his family full time?
Yeah, I've had this question and I'm waiting to see what the guidance is. Before this, the guidance was if you live alone, you could connect with one other household. And I don't know what's the recommendation going to be for this stay-at-home order. I haven't seen it yet. So more to come on that. I still think, though, that we all need to recognize that the more we can stay at home, the better it will be for us and for preventing the spread of COVID. Absolutely.
And then we've got a couple of daycare questions. Isabella and Mom from South Mississauga basically have the same question. Is it safe to send my child to daycare? Is it safe to say, yeah, is it safe to send my child to daycare, and daycares are still open, but schools are not? So what is the difference there?
Yeah, so childcare is open, as I understand, as an essential service. There's emergency childcare for essential workers, which is more than just healthcare workers. Like there's a long list now of essential workers. And so childcare has public health measures that are in place to prevent the spread in childcare centers. The reason why it's open, just like some schools are open to provide education for special needs students. And so the idea here is the ones that are open are following the public health measures and are to prevent any additional spread.
So as far as possible, they're safe.
Exactly. They are, and the point here is that if you need childcare, it's available to you and will be offered in the safest way possible.
Okay. Okay. Okay, Joe asks, should people get tested for COVID if they just have minor cold symptoms and will be staying inside anyway?
So, this in March when we had this, when people had minor symptoms, we said stay home, even if it could be COVID, don't get tested. Now we actually want, we actually have testing capacity. We're actually even messaging to students and parents, if your child is sick, please get them tested. Because I think when you get tested and we know that you're positive, it's that contact tracing piece that can then be followed up to make sure that your people who you had close contact with are identified. And so that's why we would still recommend testing.
Okay, even with mild symptoms?
Even with one symptom, yes.
Okay. And then Jennifer asks, what other things can be done to stop the spread of COVID? We're now under lockdown. There's more extra measures, but the numbers still keep rising. What more do you think we can do?
Well, I think the more intense, the extended lockdown with more measures, a stay-at-home order, like that is more than what we've had. More businesses that will be required to close, more people required to stay at home, schools in some places closed for longer periods of time. And so that is, it does work. We saw it work in March. And so what we need essentially what we need, if you want to boil it down, is we need each person to have no contact with other people, no close contact, only with people inside your home. And that's what we know will prevent the spread of the virus.
Okay, and I'll just squeeze this last one in because it's coming in live right now. Why are hospitals still allowing visitors during a state of emergency?
I believe that the hospital visitor policies, again, everything is all in flux. And so again, the orders just were announced yesterday. So there will be a lot of changes that will be in place. So more to come on that.
Okay, and that brings us to 1 o'clock. Thank you, Doctor, so much for taking the time and patience to answer all of these questions. Thank you to everybody that sent us questions. If we didn't get to them, we'll try and get to them next week. See you next week, Doctor.
Okay, bye.
Bye-bye.